Welcome to LATAM MedTech Insights. Today we are exploring the dynamic market for digital X-ray and radiographic equipment in Latin America. This region presents a massive opportunity, with market growth driven by significant government investment in healthcare infrastructure and a rising middle class demanding better diagnostic services. The transition from outdated analog systems to modern digital radiography is accelerating, creating a surge in demand for innovative imaging technologies. Countries like Brazil, Mexico, and Colombia are at the forefront of this transformation. Their public and private healthcare sectors are actively seeking to upgrade their capabilities. The primary driver is the modernization of healthcare systems. In Brazil, the Unified Health System, or SUS, is a massive public network that is continuously upgrading its diagnostic imaging equipment to serve millions of citizens. Mexico is experiencing rapid growth in its private hospital sector, catering to both locals and medical tourists, which fuels the need for state-of-the-art technology. Meanwhile, countries like Colombia and Peru are actively improving their regulatory frameworks to attract foreign investment, making them increasingly accessible markets for MedTech companies. This creates a perfect environment for manufacturers of both stationary digital X-ray units and portable, flexible solutions that can be used in diverse clinical settings. However, capitalizing on this opportunity is complex due to a fragmented and challenging regulatory landscape. There is no single registration that grants access to the entire region. Each country has its own distinct regulatory authority and set of requirements. For instance, Brazil's ANVISA has one of the most stringent and time-consuming review processes in the world, requiring a complete technical dossier in Portuguese and a local entity known as a Brazil registration holder. In Mexico, you must navigate the COFEPRIS submission process, which has its own unique documentation and labeling requirements in Spanish. Argentina's ANMAT and Colombia's ANVISA present their own specific hurdles. Consider the real-world case of a European manufacturer with an advanced portable X-ray system. They targeted both Brazil and Mexico. After preparing their CE mark technical file, they discovered it was insufficient. For ANVISA, they had to conduct additional local testing and reformat their entire dossier, a process that took an extra 9 months. For COFEPRIS, they faced unexpected delays because their labeling did not meet specific local standards, forcing a costly redesign of their packaging. This fragmented approach resulted in significant budget overruns and a critical loss of first-mover advantage. Successfully entering the LATAM market requires a unified strategy that addresses each country's specific needs from the very beginning. It demands deep local expertise and a streamlined process to turn regulatory complexity into a competitive advantage. For more information on how to build a successful market access strategy for Latin America, you can email or visit Chen-Global.